Hi, everyone. My name is Lucy Sandell, and I'd like to welcome you to our Northwestern University Cat's Career Chat today. I'm very pleased to introduce our speakers. They are Laura Lopez Gonzalez. She's a health and science editor and writer with 15 years of experience covering health globally and in Southern Africa. Laura has headed up more than half of all South Africa's specialist health reporting news services. Most recently, she spent 4 years as the deputy editor of Bikasisa Center for Health Journalism, and before that was the deputy editor at Health E-News. Andrew Wooyoung Kim is a PhD candidate in biological anthropology at Northwestern University and an incoming postdoctoral fellow at the Department of Psychiatry at Massachusetts General Hospital and Harvard Medical School. His research integrates biological, epidemiological, and anthropological approaches to understand how social oppression becomes embodied and produces health inequities in historically marginalized communities. And now it's my great pleasure to hand it over to Laura and Andy. Thank you.
Yeah, thanks so much, Lucy. And just first of all, a huge thank you to Lucy for putting this all together and a lot of behind the scenes work. And Andy also and I just wanted to say thank you to everybody who managed to attend. We know that that's like a real thing in the era of Zoom fatigue. Andy, if you want to go to the next slide. Thanks. Yeah, so Lucy already did a little bit of an introduction. Just to say that Andy also recently successfully defended his PhD, so we're all very excited about that. He's got a doctor in front of his name now. And I'm also an alumni of the Medill School of Journalism at Northwestern University. For those of you who are on Twitter, we'll be using the hashtag ScienceCom or SciCom at the bottom of the screen for this chat. If you'd like to share a bit about the chat or your thoughts. And we wanted to get a little bit of a sense of who was in the room, and I'm going to see if this works, and maybe Lucy can help me out. But by show of hands, how many people in this chat are researchers? I wonder if this is going to work. Anyone? I think you can use the hand function. Is anybody in this room a journalist? Okay, we'll see how that goes. We tried.
No, I know a handful of researchers here, so I don't know.
Oh, cool. Yeah, very cool. Great. So, so let me take you a little bit through, sorry, just lost that screen. Through the presentation. So first, this presentation will focus on health journalism and health research. But a lot of what we're going to talk about, especially the tips at the end, are pretty generalizable to science communication as a whole. So we hope that you find this useful, even if your work is outside of the healthcare sphere. We're going to start by giving a brief introduction about the relationship between media and healthcare, and how health journalism works, and how COVID-19 changed that. And then Andy will share a little bit about his really important research from South Africa. It was quite groundbreaking, and how he used the media to help tell that story a bit better for a broader audience and communicate his findings more widely. And then finally, I'll give you some tips from an editor in areas that I find researchers struggle with when they want to communicate about their work. And this is really gleaned from 10 years of editing and commissioning researchers and scientists to write op-eds. And we'll also conclude by giving you some practical tips and resources to really kind of get going in this sphere. So how does journalism shape healthcare? So it creates awareness about diseases, conditions, or issues. I think this is really what a lot of people kind of immediately think about the role of the media in healthcare. So, for instance, I think everybody's read like an explainer, like what does diabetes look like? What are the symptoms? Health journalism or the media can shape attitudes towards services or conditions and create demand for those services. So for instance, let's say that you're a country with high maternal mortality and you're going to introduce a new birth control method to your to your public to help kind of curb that, and a huge rumor starts about this. So media can amplify that rumor, and it'll reduce the demand for your healthcare product or intervention, or it can myth bust that rumor and help increase demand. And then lastly, it acts as an accountability mechanism. So both in terms of public spending, like where are we putting our money, and is it making a big impact? And also in terms of policy. So this is something that we've done frequently in Southern Africa in regards to HIV policy. You think when you're sitting in the capital city that it's going to work for a woman living in a rural area, and how does that reality sort of pair up? People think a lot of this kind of communication is really, sort of aimed at the general public. But I wanted to kind of bring out the fact that a lot of our policymakers are also not health experts. So the picture on top is a picture of the South African Parliament, and of course everyone knows the White House below. People making decisions about healthcare aren't always super experts. So when you can break down an issue for the general public, you can also break it down for a policymaker. Next slide, please. How does health journalism work? So this photo is actually a picture of the Mail and Guardian, which is a newspaper here. The team that went to the policy conference of the ruling political party recently, which is a big deal in South Africa because they are the ruling party. So what they kind of decide at this conference shapes our national policy, really. And what's interesting is that you can see there it's a mix of a lot of different people. And in that crowd, you've got political reporters, which seems like a very obvious sort of point, right? But you also have economic reporters and also health reporters, because health is also, can be political. And then you have editors, which are kind of like managers in the journalism world, and also reporters. So health journalism in general is really a team sport. We work within a team of editors, journalists, the production side of things. So when you see an awful headline paired with a really lovely, sensitive article, it's because the journalist did not write the headline and oftentimes did not see it before it went out. How do health journalists find stories? We read other publications, we read research studies, we talk to sources to find and report our stories. We translate, and we also, really importantly, and this is super crucial to remember, we translate the science to meet our audience where they are. And this is something that makes or breaks good health journalism, but it's also something that makes or breaks good science communication. And we use peer-reviewed research as an important resource for fact-checking. Next slide, Andy, please. So how did COVID-19 change health journalism? Everyone became a health journalist, so that was an interesting phenomenon. You might have heard the term infodemic, right? So we had no idea, no one knew anything about this disease, and all of a sudden there are a gazillion studies that are coming out every day, and new findings and observational findings. That was overwhelming, I think, for the science community. It was equally overwhelming for journalists covering the issue. It became way harder to fact check, even claims by experts without established data. So, in the regular sort of time, outside of COVID-19, we would refer to a peer-reviewed study, and that wasn't available. Preprints, I'm sure many of you are familiar with, became an imperfect solution for that. It changed the way we reported physically. It changed the way that you thought about stories, about how to conduct interviews, how newsrooms were managed, how we managed our own risks, and then mental health issues that were common that were going on in the public were also happening in our newsrooms. General reporters, I think, struggled to understand how science knowledge was produced. So big learning curves when it came to understanding like mathematical modeling, while all of a sudden something we thought we knew yesterday is not something we think we know today. I think conversely, health reporters were pushed to better understand financial flows. So you've seen this in South Africa, and it's increasingly being talked about in the United Kingdom. But countries went to a lot of emergency procurement systems to try to get, PPE, other kind of materials, and those are usually less sort of rigorous processes. So you're seeing a lot of corruption allegations come up in South Africa, which has a whole knock-on effect for a lot of things. I think in general, there's probably a greater awareness among newsrooms about the value to have health literate newsrooms after the pandemic. Whether or not that leads to investments is another thing. And then next slide. Is that... so now I'm going to turn it over to Andy, who's going to talk to you a little bit about this amazing research he did and the work that went into translating that for a broader audience.
Great. Thanks, Laura. That was a great introduction and sort of an overview. I think especially for the researchers in this group, who just don't have a lot of familiarity with what science reporters and health journalists really do on a day-to-day basis. So today I'll be kind of talking to you a little bit about my own experience translating the research that I had conducted on COVID in a wider setting. But before I get to that, I just want to give some slight background in terms of the context that we were working in and the research, or the issues that really motivated this research. So COVID-19 hit South Africa on March 5th, 2020, which is when the first confirmed case was. And 3 weeks later, President Cyril Ramaphosa had instituted a national lockdown, which was similar to a lot of other countries, a risk-adjusted tiered system that was allowed to change based on the social circumstances of the pandemic in larger society. The onset of the COVID-19 pandemic was particularly concerning for the country and others that have relatively high rates of pre-existing comorbidities like non-communicable diseases, so obesity, heart disease, things of that nature, and also a double burden with infectious diseases like HIV and TB. And in South Africa as well, there were already ongoing issues like poverty and unemployment nationwide. So just to give you a little sense of what COVID looked like or continues to look like in the country. So since March, there have been approximately 750,000 confirmed cases of COVID. The death rate in South Africa is quite low, which is quite remarkable, especially relative to the death rate of other countries. And there have been just above 5 million tests that have been conducted. The main peak of the pandemic hit around late June to early August, or late July to early August, as you can see in this graph below. And since this first peak, we've been really enjoying level 1 and sort of the lower rates of infection across the country. But of course, there's still the potential concern that there may be a second wave that's coming along. That's still to be determined. But for now, we've passed the first wave and really starting to be in a time where we're evaluating what happened, still processing how it's affected us, and trying to think of ways to move forward. So on top of the pre-existing social and social conditions in South Africa that made the onset of COVID quite concerning, the issue of mental health was already an ongoing concern, and this was not something that was only specific to mental health. I would say it was specific to a lot of different public health conditions and socioeconomic realities across the country. In South Africa, or in terms of mental health in South Africa, looking at this at a continent-wide level, South Africa reports among the highest rates of adult mental illness in the sub-Saharan context. But despite this high burden of mental illness nationwide, only a very small percentage of people actually receive treatment. The rates of medical insurance, enrollment in medical insurance is quite low, as you can see here, it's 16% among citizens, and among individuals who are able to access, who are able to access and do access public mental health care systems, they're often met with overburden and under-resourced settings, which could lead to things like, greater rates of relapse, maybe later follow-up, or later diagnosis of disease, and just worse morbidity overall. So this graph just shows some figures from the country's largest call center, crisis call center, hosted by the South African Depression and Anxiety Group. It's the largest mental health NGO that also runs this massive helpline that gets hundreds of calls every day. In March, which is when the pandemic first hit South Africa, they're on approximately 20,000 calls per month, or that were tracked in March. But as you can see over time, as the pandemic exacerbated, the number of calls to SADAG had increased almost 2.5-fold. Even though we don't have these specific statistical analyses, we can pretty much assume that this rise in the number of calls is likely related to the burdens of the lockdown. I'm in South Africa now and moved here last year to start my dissertation research. And while I was running my dissertation research, my project was interrupted by COVID, but I knew that this would be an interesting opportunity for me to use the data that I was already collecting, the knowledge that I developed at Northwestern to make use of my training and apply it to the current public health context. It was no surprise that there weren't a lot of mental health resources or sort of research efforts focusing on COVID. So this is one reason as to why I decided to shift my project to evaluate the perceptions, experiences, and mental health impacts of COVID. So here in this slide, I'm just showing you a little bit about the study that I was working on. Before the pandemic happened, I was organizing a large community-based epidemiological survey on comorbidities among close to 1,000 adults, where we had a suite of demographic, health, and social-related data. And then after the lockdown happened, we shifted our data collection to do telephonic interviews with participants and follow-up surveys where we evaluated their just general perceptions and experiences of COVID. This is specifically in a large township called Soweto, southwest of Johannesburg. And we also assessed depression risk using a mental illness screener. And overall, what we found was, unsurprisingly, a strong association between people's own perceived risk of getting COVID and their depression scores. So we asked participants, relative to other people living in your neighborhood, what's your degree of risk? How much of risk are you at? Less compared to others, similar risk or more risk. So we see a strong relationship between perceived risk and the depressive symptomatology. In this next slide, I'm showing you some preliminary evidence that individuals who had worse histories of childhood trauma or greater experiences of reported childhood trauma tended to do worse when evaluating the mental health impacts of perceived COVID-19 risk. So as you can see here, by the red dotted line, people who have more childhood trauma responded the worst to the impacts of perceived COVID-19 infection risk when looking at their depression, their levels of depressive symptoms. So these data were published in two avenues. First, as a preprint, since we knew these data were urgent. This was, to our knowledge, the first empirical study of mental health and COVID in the country, specifically aimed at evaluating the mental health impacts of certain aspects of living under the quarantine and the larger pandemic. And then after our submission to psychological medicine and a series of revisions, we've since published the final manuscript, which is open access, which is awesome, and the basis for the article that Laura and I collaborated on. So just a few concerns I wanted to note before really talking about the project that we did. There were a lot of apprehensions on my end about moving forward with or even conceiving this idea of writing an op-ed about such new data. So after I ran these models and we published the paper as a preprint while I was still in press, I knew that this would be relevant information and important to kind of get the word out, especially given the massive mental health burdens, as I discussed a bit earlier. But there are a few things on my end that made me apprehensive to move forward. One, there's a pretty strong stigma, I would say, against journalists and the scientific community, based on this perception that journalists misrepresent findings, which unfortunately does happen, and can have pretty inconvenient consequences when it comes to how people make sense of their health, especially during a time like this current pandemic. I wasn't really comfortable with my writing abilities, but especially my writing abilities for a more public audience. And I also had my own concerns around misrepresenting my research, partly because of the discomfort I had with writing to a public audience. And then, as I alluded to a little earlier, public consumption of scientific research and academic literature overall is pretty low, but also when certain academic findings are translated, it's not uncommon that the actual intended research finding is accurately depicted. So you might hear someone saying, "Oh yeah, if I take vitamin B12, I'll grow an extra foot or something." I mean, I'm sure. I hope no one's saying that, but we don't want that to happen. But I also felt like there was a lot at stake. So, like I said before, there were no empirical studies on mental health and COVID-19 in South Africa, let alone the broader sub-Saharan continent. There was very little empirical research on mental health and COVID-19. Like I also said, there was scientific and academic research is quite inaccessible to a broader audience, especially those who are most impacted by COVID-19. And I also had just my own interests in trying to write to the public and share my research. So after kind of having my own internal conversations, especially around my sense of perfectionism and needing to write like Carl Zimmer or these other like profound scientific journalists, I moved past that, which honestly was a huge kind of step moving forward with this process. I think a lot of us academics are really concerned around producing something that we think is up to our own standards, or also have our own concerns around the quality of work that we produce. But I don't think we should let our own concerns around messing up prevent science from being communicated, especially if it's really interesting. So one, I dropped the perfectionism. After that, I identified an outlet. What's the best place for me to write about these findings in a more public avenue? So I already knew about Becky Sisa. It's Becky Sisa Center for Health Journalism, a really great health reporting center that does a lot of rigorous fact-checking and awesome scientific reporting. I've been following their work for a while. I knew this was the best place to place the potential op-ed. And then I reached out to Becky Sisa and connected with the editor Laura, and we made a plan in terms of a timeline, what needed to be in the op-ed, kind of common misconceptions and mistakes that first-time writers, especially who are scientists or researchers, make when writing to a public audience. And I would say that this step was actually quite important because it allowed me to air my concerns, talk out my ideas, and realize that this was something that was that was attainable and quite exciting. and also it was good to talk to someone because I think this was during like the peak or like the height of the the pandemic, probably a little before, but I wasn't really talking to a lot of people. And then after that, there was a series of iterative, editing, drafting, and after about, I would say, 2 or 3 maybe rounds of revisions, we got to a final state where we published this op-ed. So this op-ed largely talked about, was initially focused around, describing the mental health impacts of COVID, but after kind of talking to Laura about some of my ethnographic work with SADC, with the mental health NGO that ran the helpline, and just kind of some of her own, journalistic expertise in terms of what works and what framing would be interesting, we decided to kind of shift the narrative to talk about, to really kind of like use this NGO's experience and fielding all these calls and dealing with this unprecedented pandemic to provide a more grounding sort of explanation of how COVID affected people's mental health. So since that happened, so we released the op-ed. Along with releasing the op-ed, Becky Sisa, of course being a media organization, had a plan to also disseminate our op-ed to partner organizations. Eventually, actually, like a few hours after we went live, I had a couple of people reach out to me. 702 Radio, which is a cool radio station that people tune into, especially during their morning and afternoon commute. Newsroom Africa, a cool online or a cool news organization on TV, and even Scientific American, the Arabic version, reached out and all wanted to cover certain aspects of the study. And this was completely new to me as a researcher and as a scientist. I was just already kind of thrilled that this was accepted into like a semi-high impact journal, but after getting all these people reaching out to me and realizing that more than the 25 people who would likely read my article anyways was attracting, I guess the journals, the articles attracting more attention. It was great to be able to engage with more public stakeholders around the work, the impacts, the finding, and probably one of the most sort of like meaningful experiences that I've had while here doing my field work. So I did all these things. I was really not prepared, I would say, to have my face be the size of a wall or be on radio, but I just kind of did it, and was briefed by Laura and the people at Becky Sisa, pretty simple things, keep it short, major points, and it went okay, but I really started seeing the benefits of engaging with the media pretty instantly, I would say. There was a lot of activity on social media and Twitter. There was a lot of activity sort of in like internal South African public health spaces. There was even activity in like the mental health NGO sector, especially when SADC shared and disseminated the op-ed. So there was a multiplier effect when it came to the benefits of the op-ed. But in addition to that, there are 2 things I want to highlight. One, that this could also have very relevant academic benefits for researchers, especially those who are trying to get their name out or attract the attention of potential funding bodies. So one of I was currently at the time I was on an NIH fellowship, a National Institutes of Health fellowship for global health, and the media team from the organization reached out and requested to cover the piece, which was highlighted in a number of sort of internal and external outlets at the NIH, which was super cool. And those are all things, at least for any of the scientists who are out there, they know, that these sort of, anything really helps when it comes to trying to get an NIH grant or get your name out, or show people that your work is interesting and it matters. The next example I'll talk about in the next slide, but yeah, scary ... definitely scary experience. I'll say, not gonna lie. But this example that I wanted to pose was my engagement with the Cambridge University Press, who is a publisher for the journal that for psychological medicine, the journal that published our work. So Cambridge University Press reached out to me requesting to write a press release about the study. I thus connected with the communications associate, doing a short sort of interview about the study, giving my reflections, and I thought this was also one of the more meaningful parts of the process, where I got to insert my own voice, but also give sort of policy recommendations or highlight important aspects of the study, and which is really to improve the availability of emergency mental health resources and the larger mental health infrastructure in Soweto and Joburg at large. The Cambridge U Press wrote up the press release. We went through various drafts, and this was also a really rewarding experience because I was able to, kind of shape the narrative of the press release, and really interesting process. And ultimately, Cambridge University Press sent out the press release to their partner organizations, so a lot of media outlets in South Africa as well as the United States, and some of their connections in Europe, which is how I think Scientific American, the Arabic version, got in contact with us through the Cambridge Press reaching out to them. So this was a great opportunity. Also, it doesn't hurt to have this great publishing house on my CV, but also that this is obviously a reputable organization that is the publisher for a number of different academic journals, so the coverage was pretty awesome. And this is just a screenshot of the altmetric page. For those who aren't familiar with this is just a metric created by certain publishing groups to assess how much coverage your article had received. And as you can see here, there are about 7 different news articles at the time that I took a screenshot that covered the research, which is pretty awesome. So the major takeaways. First, op-ed writing isn't as hard as we make it to be, which is why I have the face of have this meme up. In the beginning, I was really concerned and confused about the process, but I guess this leads to my second point. There are many resources available to assist you. You're not just some lone researcher writing about your work to unknown audience. There are a number of different people within the newsroom who are able to support, most likely the editor. And at least for me, I had a fantastic editor I was able to work with, and we were able to turn this around in a rather quick time frame, and in a way that was really meaningful and enjoyable. As I emphasized before, the return was huge in terms of coverage, press, the sort of social capital that I developed as a result of it, different connections I got, and the overall impact. In fact, I would say the biggest sort of return was that when I was connecting with Cambridge U Press about the press release, I got connected with one of the editors at Psychological Medicine, the journal, who ended up being the chair of a review committee at the NIH that would likely fund grants that are related to my work. So that was a really great connection to have. And now I'm kind of on. I have developed this sort of new colleague because of that. And we're all really interested in trying to see how this resource could potentially be useful for other people. So please keep us updated.
Yeah, I think I think Andy touched on a lot of really important points. I think the perfectionism, like journalists, we get it too, there's a reason why there's so many people in a news production team, right? There's a lot of hands on that copy, a lot of people helping people get it just right. I think also, if you're scared about science being miscommunicated, that often happens because the press releases which are done by a comms department and not the scientist, were often incorrect. So I think this role that Andy played with Cambridge University, going back and forth and checking that press release, is something that fundamentally should all be asking to do anytime somebody's going to put a press release out about your work. And then, I think, just really great to hear that people are overcoming some of the things that writers talk about all the time. So here are 3 tips about communicating your work that you should kind of keep in mind about. So first of all, the number one thing you need to figure out is why you're communicating. So in Andy's case, we were in a country that went under lockdown. There was no mental health services being provided deliberately as part of our lockdown care package to people. So his work was really important to possibly shape a policy intervention, and he pushed it out in a timely manner, right? So when something could still be done about the problem. So you need to ask yourself, what do I want to happen with this, and who do I need to talk to make that happen? Because that will decide your audience. And when you decide your audience, then you can figure out how to reach them and also speak to them. So what media does my audience consume? What languages do they use? And here I'm talking not just about Spanish or English, but really about what kind of level of kind of medical jargon, detail am I going to go into? And that's decided by who you're talking to. Are they technical people? Are they lay people? And then third is really to be available. So the more open you are to communicating with journalists, the better chance you have of ensuring that your stories are accurate. And I think, then I think, and then next slide, Andy, please. Thanks. So here's some tips from an editor. And this is, again, I've worked with writers for 15 years doing this kind of work. The other thing I will say is don't be afraid to be edited, because I guarantee you that the people who are working at those big opinion piece sort of hubs that you're all reading, I won't mention name, they're definitely doing a lot of work on those pieces to help people get stuff, get their messages across. It was really great talking to Andy through the process, because he actually had a lot of other experiences that for a lay audience really take this message home that were not always encapsulated in his peer review research, but I know for a fact happened to a lot of researchers. You're engaging with a community, you're talking to people. Those anecdotes are interesting for a lay audience. So if you want to approach a publication, my first tip is read them first. Publications are very deliberate in the way that they craft their voice. It's your job as a writer to fit into my publication style and not the other way around. Be timely. Afraid your writing isn't good enough. Don't worry, nobody comes in there thinking that that they're perfect. We all have these fears. Editors can help. It's our job. When you take interviews, think about how you're going to translate that message for that audience, right? So a journalist is going to come, you're going to know the publication that they're writing for, and you're going to be able to get an idea of where you're pitching that message. Develop talking points before you go into an interview to help keep you on track and help simplify your message. And then also, you can always ask to check your quotes before publication when you're talking to a print journalist. You cannot ask to check the entire story, because that goes into that sort of infringes on a publication's editorial independence. I will say, as a science journalist myself, though, I have sent, when I've done science translation, maybe trying to break down a sort of a big scientific concept into something for a lay audience, like biomarkers and vaccine development, I might send snippets of that to the researcher to make sure that I've translated that accurately. And then next slide, please, Andy. So we've packed a lot in this sort of presentation. If you're interested in writing an op-ed, I've got a free guide that kind of goes into some of the details a bit more, including pitching, which is probably the hardest part. And you can download that for free. And I'll also pop these links into the chat. To increase diversity in health sources, I offer free one-on-one mentoring sessions on SciComm for health researchers, activists, healthcare workers of color, and you can sign up for a session. And then finally, please do get in touch with Andy or myself. Andy's got a lot of practical experiences. He's faced these fears. He's figured out tips for dealing with editors, and we're super excited about helping people democratize science and really get their message out. So please do email us. You also have our Twitter handles at the beginning of this, so we're definitely open to taking this conversation further. And with that, I'd like to open it up for questions.
Great, thanks. And if you didn't get the directions down or the emails down, I will send them to all the participants in the post email message that I send out after every event. So we've got people who are really impressed with how you managed all this, Andy, to bring it beyond academia to the general public. And research is consumed by a lot of different communities, so it's important that what you've done. I will just launch off with a couple of things that Laura, you mentioned early on that policymakers are often not scientists, and journalists are often not scientists either. How do you navigate trying to make sure that you get the information correct, especially with something like the novel coronavirus that was brand new?
Yeah, I think that's a really great question. I think everyone sort of stumbled at some point during COVID-19, just because that information was changing day to day, because you were knowing different things literally 12 hours apart. But I do think for me as a journalist, and what I teach my reporters coming in is I will sit down with them and we'll go through scientific medical research, and I'll just teach them a brief way to read a scientific paper. So in my newsrooms, you are not allowed to just read the abstract. You are not allowed to just read the press release. You've got to read the entire paper, and I'm not expecting you to talk about everything in there, but I want to give you a quick tool on sort of the hierarchy of information in that research, and then getting to kind of grips with some basic terms we use in medicine, and then also a very crucial interviewing skill, which is something I used a lot in my early days of HIV reporting, but an idea of back translation. So you're in the middle of a research, an interview with a researcher, they've said something super complicated, and you're in that moment, you need to try to be okay, so what I'm hearing you say is, and then you say it back to them in regular speak, so that you're taking that moment to actually do the science translation with them. Is one of the things I picked up.
That makes sense, because a lot of times I've read things and I think I didn't follow that at all. And it's difficult for me to do that as a reader, to figure out what they've said. So I appreciate that you require that from your journalists. Andy, do you find that if you give the population ways to mitigate their risk, their depression symptoms go down or at least don't increase?
Can you say that one more time?
Sorry about that. You were talking about how the population's mental health was being radically affected by COVID-19, and it has all over the world. Do you find that if you give the population ways to mitigate their risk, talk about the hand washing and the social distancing and the masks, that their depression symptoms may go down or at least not increase?
Yeah, it's a really interesting question you asked. I'm almost convinced that you read my with the paper with a fine-tooth comb, because we actually found that in this study, people who had more knowledge about COVID reported greater depressive symptoms, and we think that's first of all, this is like a cross-sectional relationship, so it's not conclusive, and it's not I guess like it's not a like theoretically and hypothetically driven conclusion, but it is an interesting relationship. One thing we talked about in the paper was that we think that people who had more knowledge around COVID had worse mental health impacts, just because they were just more aware of what was going on, and had a stronger sense of the risks that they faced. And given the context that we were working in Soweto, which is pretty, I guess, like a pretty diverse and mixed income community, there's still a number of sort of resource shortages. So having an awareness of these various risks for psychosocial insults, but then at the same time knowing that you don't have a lot of resources to access care or different types of risk mitigation resources, could put you at a pretty distressing situation. So I will say also that the study was conducted in the first 6 weeks of the lockdown in Soweto, and the pandemic looked really different just like a month or two later. So we have follow-up data that we're currently analyzing now to try to look at sort of long-term patterns, but hopefully I'll be able to address that. Actually, I'll definitely I'll run those numbers and let you know what we find.
Great, I look forward to it. Thank you. Garrett asks, what are some of the benefits that you've seen from healthcare workers and researchers writing op-eds? If I have a choice between writing another paper and an op-ed, why would you motivate the time to write an op-ed for Laura and Andy? This question.
I can speak a little bit about historically what I've seen happen with these op-eds. I think, as Andy's mentioned, they tend to have a multiplier effect. So one op-ed tends to give birth to 3 other pieces of media, because what the op-ed has done is it's translated the research for the other journalists that will never read that first paper, but will read the op-ed. So you're doing the heavy lifting for journalists. I think it really kicks the ball, gets the ball moving, rather. I think I've seen rural doctors write about their frustrations on a certain issue. That was picked up by the National Department of Health in South Africa. They were invited to become part of task teams. I've had researchers who wrote about the underfunding for climate change. They were invited to help by the National Department of Health to write a strategy for the country. I've seen people get funding from it. I've seen people kick off an awareness drive of an issue. So there's an expert that writes an op-ed. It leads to not only the usual pickup that you get where other people are just kind of quoting that thing, but also prompts more reporting on the issue. So getting in there and seeing what's going on with an issue. And also I think it kind of has... People who write op-eds are more Googleable. You kind of get what they're talking about because you have to read the study. And so they really become experts that media tend to turn to. So we have one writer in particular at Bekasiza who is now regularly called by the media to talk about, for instance, climate and mental health.
Cool, yeah. And I want to highlight one thing that Laura kind of alluded to earlier in the presentation, which is that depending on what your goals are, writing an op-ed could actually really enhance what you set out to do. So, for example, if you're using, you're conducting research that you want to have some sort of policy impact or some sort of tangible next step, especially if it's relies some sort of political will. I think having your research communicated to a broad audience is of utmost importance in that aspect. And in this case, that's exactly what we thought. So because there was a lot of psychiatric morbidity across the country, low access to mental health resources, and really no prioritization of mental health in the sort of the mitigation policies in terms of the health impacts of COVID. Highlighting this as an issue was was really important. And it's not like, I wrote this op-ed just based on what I found in my research. I also communicated with, obviously, Laura, but other mental health organizations, SOSADA, for example, other researchers, friends of mine who have, a strong understanding of the health policy framework or landscape, and just trying to see, what, is this worth writing about, and what can be said. And I think it was definitely a resounding yes. And as a result, this obviously, this piece has been picked up by a number of pretty major national news outlets in South Africa, and I've also seen it being discussed in other pretty international forums. For example, the Lancet, which is a pretty large and historical medical journal, cited the op-ed and not my research, which I thought was really funny. but that's great. I think it's a really interesting sort of another way to engage with both the audiences that you intend on engaging with and not intend on engaging with.
It sounds like, again, you did the heavy lifting for the Lancet. That's what I looked at your op-ed. Lara, this seems like serendipity that Andy, as a researcher, reached out to you at Becky Sisa, and you as an editor. Does this happen often?
I think it does. So I think it's just, I think I think it does, because I think we have a brand at Becky Sisa that says we take the science really seriously. We take it super seriously to get it right, and we do kind of hit a policymaker audience, even though we don't write in medical jargon. So I think that does help. As an editor, I'm always reading academic journals and trying to find cool research that I think would be of interest to a national audience in South Africa. So I also proactively reach out to researchers, and then oftentimes it's a lot of that kind of calming of fears, and then letting them know, I'm not going to do a bunch of edits to your op-ed and then push it out without you, seeing it. So especially with opinion pieces, you'll definitely get final sign off. So I think it's a nice sort of baby step into public communications in that way.
Great. Well, we're almost at the top of the hour, so I want to thank you both, Laura and Andy. It's almost 9 o'clock your time, so really appreciate you spending the evening or early evening with us. And do you have any final words for the group?
Yeah, I think if you are a scientist and you are doing work, really please consider this as something that can really democratize your work. There's a bunch of people who should know what you're talking about that will never have access to an academic journal, and they deserve to be in that conversation. So really, I hope that you become as impassioned about science communication as we are, and know that there are definitely resources to help, and that we're available to help you do that.
Yeah, I second that. And also, coming from the researcher side, it's like I said, I had a lot of concern around this. The payout was great. I also just developed as a writer, and feel a lot more confident in really talking about my work and just trying to be a more publicly engaged scholar, and met cool people along the way. I'm happy to kind of see where this conversation goes. If you have any questions for us, please let us know. But thank you so much for attending.
Thank you both again. It was great. I was really looking forward to it, so I'm really happy that we could make this happen. Thanks everyone for joining us today. And again, we are recording this, so I will go through and make sure that all the words are typed in correctly, and then send you a link to the recording. Thanks everyone. Have a great rest of your day. Bye.